Hi, my name is Kathy, and I just wanted to do a quick video to go along with the preoperative ostomy education that was provided to you. In this video, we'll just go over the colon as a whole, what a stoma looks like, where it may be located, and then some visual aid for appliances and what those look like for future stoma care. First, I would like to go over what is an ostomy or a stoma. A stoma is created during a surgical procedure. This surgical procedure is done on the small bowel or the large bowel, and a piece of that bowel is brought through the stomach to the outside of your abdomen. When that is done, the piece of the bowel, either small or large, that is on the outside of the stomach is called a stoma. A stoma would look similar to this, and it has an opening on the tip on the end, and that is where stool will be released from the body. Ostomies can be either temporary or permanent depending on the diagnosis of why they were created. Some of the reasons why an ostomy may be created are due to genetic disorders, hereditary disorders, ulcerative colitis, diverticulitis, colon cancer, rectal or anal cancer, trauma that's been sustained to the colon. Also, you may have like spinal cord injury patients may end up with an ostomy, and non-healing wounds, or just a malfunctioning colon can cause a patient to have either a temporary or permanent ostomy. There are two types of ostomies that can be created. So a colostomy is one type of ostomy that may be created for a patient, and that is where the colon, the large bowel, is brought through the abdominal wall, and that is the stoma that you'll see. There's different locations that are used for a colostomy compared to that of an ileostomy. And an ileostomy is where the small bowel or small intestines is brought through the abdominal wall. As you can see, this is a diagram of a colon or large bowel. So on the right side of your abdomen, that is the ascending colon, and that is where the small bowel meets the large bowel, and it goes up on the right hand side of your abdomen and across the top of your abdomen. That's called the transverse colon, and it comes down on the left side of your body, of your stomach, and that is the descending colon, and then it comes down, bends and comes down into the rectum where waste is excreted. So if you had an ileostomy, that would be on the right lower side of your abdomen, and that's where the small bowel meets the large bowel. So you would have a stoma around the right lower area of your stomach. If you had to have a colostomy placed in the ascending colon, which goes up the right hand side of your stomach, you would have a stoma approximately on the right upper side of your abdomen. You can also have a transverse ostomy, and that would be on the left upper side of your abdomen. If you had to have a descending colostomy, that would be in the lower left side of your abdomen. So when you have ostomies placed in different sections of the colon, their stool can be expected to be different based on that location. So if you have an ileostomy placed at the small bowel where it meets the large bowel, you will have more watery stools. And this is because water is absorbed more in the large bowel. So when your food processes and goes through the small intestines, it doesn't have a lot of consistency. It's very thin and liquidy. So in the large bowel is where the water is absorbed before excreting through the rectum. So if you had an ostomy at an ileostomy at the small bowel where it meets the large bowel, your stool would be expected to be watery and greenish yellow in color. If you had an ostomy in the ascending bowel, then your stool will still be very soft and maybe watery there too, because the water's not getting absorbed like it normally would if it went all the way through the colon. So if you had an ostomy at the transverse colon, so on the left upper side of your abdomen, then that stool would be a little more formed and soft, but not nearly as liquidy as the ascending colostomy. Once you get to the descending colostomies, your stool will be more consistent with what a normal formed stool may look like. It will still not be completely like a normal formed stool, but more like a normal formed stool, because it has had all this colon to absorb that water, making this stool thicker, and the electrolytes and everything have been absorbed through the colon, so it's drier than what it would be with an ileostomy, which would be virtually liquid. When an ostomy is created, you would start to wear a pouch such as this one that would help catch the stool when it's excreted from the body. These appliances come in all different backings. They come as 2-piece, 1-piece. Some of them have a convex, which is what this is, with this extra ridge on it right here, backing. Some are flat, such as this one. And there also are 2-piece appliances where there's a backing that sticks to the skin, and then the bag itself will then connect through this ring, and it connects to that sticky part that's the backing that stays on the skin. This allows for you to kind of burp the bag, and what that does is means that you can detach this ring from the backing and let the air out of the bag. These other bags that are 1-piece, like this, and like the convex bag, which are 1-piece, and the convex is that ridge, they have to be opened from the bottom so that you can let air out of the bag. So if you have to burp the bag, which is releasing gas from the bag, then you would need to open the bottom of this and let the air out. The bag for an ileostomy, this is a great way to help build that up around the base of the stoma and protect the skin around the ileostomy. Colostomies are different because the stool consistency is different. However, it's not a bad idea to use a strip paste or a molding ring anytime when applying your appliance. With the stoma, when it's new, the stoma will be a little bit larger when it's new due to the surgical intervention and swelling. Just as any time surgery is done, you know, the body reacts and there may be some inflammation, and that's true in the case of a stoma as well. So measuring the stoma is a great thing to do every change that you do with the ostomy appliances. So if you have this scale here, which we were going to use for a template, it also has a measuring device on each end so that you can measure and keep track of your stoma size. So your stoma may start out a little bit larger post-surgery due to some swelling, and then as the days go and healing is happening, your stoma size should actually get smaller. That stoma should shrink in size and should become more of what the size that it's going to stay as long as you have it as time goes on. So you should measure with every appliance change, which is at least every 3 days in the beginning of healing process post-surgery. keep track and make sure that the stoma size is decreasing. That's what we're looking for. And then you can use this, as I said, as a template, or any of these as a template, but measuring that with the ruler that's on the side of this across the stoma and up and down the stoma will help give indication that it's going down in size as it should at post-surgery. There are numerous types of appliances and different things that you can use with them. So there's multiple types of bags, the 2-piece, the 1-piece with a charcoal filter to help with odor, without it. All kinds of things that you can use, and there are great companies that can help you pick out the type of bags that would fit best for you. There are a couple of companies like Hollister and Convatec, Coloplast. They all have equipment and different things that you can use for ostomy care and appliance use. Also, when you are post-surgery, oftentimes you are released to home, and then home health is set up for you. Home health nurses will be coming to visit you, and they'll also be giving you more ostomy education, and they'll be helping you change that bag and getting used to the ostomy skincare, and then appliances. So they have also samples of appliances and what may work best for you. You could also call the companies like Hollister or Convatec and see if they have a sample kit that can be provided to you as a new ostomy patient. They also have a person that can help you decide maybe what would be best for you to use post-surgery for your own personal needs or fit. And then give you more information about like the molding rings or strip paste, or there's like lubricating deodorant that you can put into the bag with an ostomy change to help keep the odor down when you have gas or from the stool. They can inform you more about like charcoal that's used in the bag and how that filters, and filter bags compared to non-filter bags. So they're a wealth of information, and they are there for your use. So I would suggest to call one of those companies and talk to someone, and then see if they can send you some free samples. Once you've decided what types of supplies you would like to use and the type of appliance that you would like to use for your ostomy care, you can call your provider's office, either your primary care provider or the surgeon's office, and those can be ordered for you. They can be ordered for you through either a durable medical equipment facility, which is local to your area, or they can be mail ordered through different companies like Medline that you can find online, and then you can order your supplies through them. Oftentimes with an online ordering provider, then you need to give them your information and your provider or surgeon's office information, and then they will send those orders to that office, and the provider will sign off on them, and then your supplies will be shipped to you. If you are getting your supplies from a durable medical equipment facility, then what you would do is tell your provider, either your primary care provider or your surgeon's office, what supplies you need. You would need to give that office the type of what it is. So like this, for example, is a Hollister bag, and then there's a reference number that comes with that bag, and you would give that office what that reference number is. Same if you needed like the strip paste, or if you wanted the molding rings, and like this molding ring is a different company, and you could give whatever that is with the reference number, and then that office can order those supplies for you to the durable medical equipment store. Once they're ordered and signed off on, then they can send the product to you in the mail, or if the facility is close to you, you can go pick it up. The other good thing about ordering from a durable medical equipment store is that if you are short on appliances, because in the beginning you may go through more than just one every 3 days, you can purchase them. So you could go to that store, purchase what you need, and then they would have your records of what you use in their system. So that might be an easy way to know what you need, and then they already have it for you in their system, so you don't have to remember those numbers. With the ostomy supplies, insurance only allows for patients to have so many ostomy bags per month. Insurances generally pay for one bag every 3 days, which means you generally only get 10 ostomy bags per month paid for through insurance. If you need more than that, the cost may come out of your pocket for the supplies. So if you can get free supplies through different places, like the companies who have ostomy supplies, they're great for backups. Or if your surgeon's office may have some extra supplies laying around if you need them, that's a resource to use. Sometimes there's local facilities that have like angel shelves, and they will have ostomy supplies that are there for need for patients who are going through more than one every 3 days. And you can go there and pick them up. It is not uncommon to go through more than one bag every 3 days when you have gotten your ostomy newly created. That happens often. It's a trial and error process that occurs post-operatively, and it is, tough. And there's lots of times when the bag may just pop off and the adhesive is not sticking, and maybe there's stool behind there, maybe there's liquid in the stool, and it's creating for the adhesive not to stick to the skin as well, and so then you have a leak. These things are not uncommon. Frustrating, yes. Uncommon, no. It's just a trial and error period. So be kind to yourself, and try to stay calm, and just realize that this is normal. And although frustrating, this is normal and it's okay, and there are options and ways to get other appliances so that you don't have to pay for them out of pocket necessarily. Post-operatively, for diet and watching and maintaining your stool, what you should do is have a kind of easy, soft, low fiber, low residue diet post-operatively for probably at least a couple of weeks after ostomy is created. This will help with the whole new training process of the bowel. Plus, that area just had surgery and it's kind of inflamed, and these are easy foods to be processed as opposed to eating steak and fruits and vegetables right away. And those are harder on the colon to process. And so this just gives the bowel a little bit of rest, a little bit of time to get back to normal. So after that couple of weeks of having an easy, low fiber diet, you can start to advance your diet. You can, go back to eating like chicken is great with no skin, but you can start to increase with other things such as more fruits or vegetables, and more meats that might be a little more to process, such as beef. The important thing to do when changing your diet and advancing is just to really pay attention to your body. Pay attention to the stool that's coming out, pay attention to the way it makes you feel, and then you'll know, this food was okay and I tolerated it, and you just advance from there. There are some foods that help, like if you're having loose stools, that help kind of thicken that stool. Those foods are like applesauce, bananas, white rice, creamy peanut butter. All of those things help thicken the stool up a little bit. So if your stool consistency is not where you like it to be, then you can eat different foods that may help impact that. There are also foods that are going to probably cause more gas, and that's food like onions and garlic. Some vegetables will cause an increase in gas, and so you want to just be kind of aware. If I eat these foods, then my stool is the consistency I want it to be. I don't have as much gas if I eat these foods. So those are things to kind of be mindful of. Keeping a food diary is not a bad idea. Writing down what you ate and then how it affected your stool and your ostomy and your stomach, and if it caused a lot of gas, or if nothing happened at all. All of those things are like good ideas, but eventually you'll get past that and you'll know what you can and cannot do, and then that'll be your new normal. So like exercising. If you exercised before, you can still exercise after ostomy creation. Empty your bag before you go to exercise. Be mindful of lifting heavy weights and using a lot of abdominal muscles. You do have this ostomy here, which is pulled through your abdominal wall muscle. And so anytime that there's a break in that abdominal wall muscle, you are at risk for a hernia. So just be cautious, listening to your body, paying attention to what it's telling you. But you can still exercise. You can go swimming. You want to go swimming? Totally fine. You should empty your appliance before going swimming. Change it at least 12 hours beforehand. If it's a change day, change it the day before instead of the day of going swimming, and that allows that adhesive to really stick to the skin, not allowing water to get into where the ostomy is. There's ostomy tape that you can use to help create a barrier so water doesn't seep into the bag. If your bag has a filter on it, that allows air exchange in the bag, and so you would just cover that, and then when you're done swimming, you uncover it. So you can definitely go swimming. You can travel. If you think that people can see the ostomy bag, there's ostomy belts, there's covers, there's all these things, and in addition to just regular ostomy supplies that provide comfort and coverage, so then people can't see that you have your ostomy. So going out to dinner, going to the movies, traveling far, it's all okay. A lot of times patients have an ostomy supply bag. The bag is not very big, and it can hold your appliance bag, backing, the tape, measuring devices, little scissors to cut your ostomy appliance backing, deodorizer, anything that you would need to use to change your appliance. It can hold it in a small bag. It's easy to travel with, and you can take it with you and have it on hand if you need to. So these are all things that you can do after having ostomy creation. Having this surgery is overwhelming. Having an ostomy is overwhelming, but you can do these things and then get back to your normal life and do all the activities that you were doing prior to. There are support groups that you can find online. Facebook has support groups for ostomy patients. The United Ostomy Association has support groups. You can even call some of the companies such as like Hollister, and they may offer support groups through there and give you more information on that. So there are other people that can help, and they've been living with this, and they have tips and tricks that are great advice for you, or answer questions because they've gone through it before and what may have worked for them. Having this ostomy is a big trial period of this works, this doesn't work, maybe we'll try this, then it works. It's just constant troubleshooting, and then just figuring it out and paying attention to your body, what's going in, how it's coming out, and then how it makes you feel. That is why maybe like keeping a food diary is really great, and then just kind of documenting and paying attention so you can refer back to that at any time during your ostomy creation time. Also, if something is happening and you just don't know, you can always contact your surgeon's office and ask them questions. If they don't know the answers, maybe they have a resource that can get you set up with, and then you can ask that resource or be seen by them. For example, if the ostomy starts to come out more, which is called a prolapse, you can call your surgeon's office and they can either tell you that this is okay, or, do you want us to look at it? Or we can send you to like a wound ostomy nurse and they can look at it, just to kind of help you troubleshoot these problems and get a second set of eyes and reassure you and then give you advice. So this process is overwhelming. Be kind to yourself. Don't allow it to be so frustrating. So with living with an ostomy, you can do things in your life that you just did before, and daily activities just like you did before, such as exercising, swimming, traveling, any of those things that you did prior to ostomy creation, you can do again. There may be a time period in the beginning post-operatively where that doesn't seem possible, and that's kind of just like a healing process time, that maybe you shouldn't be doing some of those things during that time, but it will get better. So 6 to 8 weeks post-operatively, expect for the ostomy to kind of be swollen and changing in size, and then also expect stool consistency to be kind of maybe up and down, and that's okay. All of those things are okay. It just takes time in learning how the ostomy works, what foods you're taking in and how that affects the ostomy, along with making sure that the appliance fits right, because the ostomy size is changing. We're learning what ostomy supplies work best for you and for your ostomy. Those are all things to just take in stride during that first 6 to 8 weeks post-operatively and during that healing process. After that period of time, things will become more normal. And then, you'll have maybe the ostomy supplies that you like the best. And then you're learning these foods that I eat, they cause this. If I eat these foods, then my stool is the consistency I want it to be. I don't have as much gas if I eat these foods. So those are things to kind of be mindful of. Keeping a food diary is not a bad idea. Writing down what you ate and then how it affected your stool and your ostomy and your stomach, and if it caused a lot of gas, or if nothing happened at all. All of those things are like good ideas, but eventually you'll get past that and you'll know what you can and cannot do, and then that'll be your new normal. So like exercising. If you exercised before, you can still exercise after ostomy creation. Empty your bag before you go to exercise. Be mindful of lifting heavy weights and using a lot of abdominal muscles. You do have this ostomy here, which is pulled through your abdominal wall muscle. And so anytime that there's a break in that abdominal wall muscle, you are at risk for a hernia. So just be cautious, listening to your body, paying attention to what it's telling you. But you can still exercise. You can go swimming. You want to go swimming? Totally fine. You should empty your appliance before going swimming. Change it at least 12 hours beforehand. If it's a change day, change it the day before instead of the day of going swimming, and that allows that adhesive to really stick to the skin, not allowing water to get into where the ostomy is. There's ostomy tape that you can use to help create a barrier so water doesn't seep into the bag. If your bag has a filter on it, that allows air exchange in the bag, and so you would just cover that and then when you're done swimming, you uncover it. So you can definitely go swimming. You can travel. If you think that people can see the ostomy bag, there's ostomy belts, there's covers, there's all these things, and in addition to just regular ostomy supplies that provide comfort and coverage, so then people can't see that you have your ostomy. So going out to dinner, going to the movies, traveling far, it's all okay. A lot of times patients have an ostomy supply bag. The bag is not very big, and it can hold your appliance bag, backing, the tape, measuring devices, little scissors to cut your ostomy appliance backing, deodorizer, anything that you would need to use to change your appliance. It can hold it in a small bag. It's easy to travel with, and you can take it with you and have it on hand if you need to. So these are all things that you can do after having ostomy creation. Having this surgery is overwhelming. Having an ostomy is overwhelming, but you can do these things and then get back to your normal life and do all the activities that you were doing prior to. There are support groups that you can find online. Facebook has support groups for ostomy patients. The United Ostomy Association has support groups. You can even call some of the companies such as like Hollister, and they may offer support groups through there and give you more information on that. So there are other people that can help, and they've been living with this, and they have tips and tricks that are great advice for you, or answer questions because they've gone through it before and what may have worked for them. Having this ostomy is a big trial period of this works, this doesn't work, maybe we'll try this.